Once they start their PG preparation, many students keep asking me in which order should they complete their subjects, whether they should go for the clinical subjects first or preclinical subjects first. How should they approach the subjects which they find it difficult? In this small video, I would like to help you when deciding which are the order of subjects in which you should complete. Let's first look at how the subjects are classified. The first column is essentially the preclinical. The second column is what typically we call it as a short subjects, which is because they can be completed in a relatively smaller span of time. And the last column represents the big subjects: PSM, medicine, surgery, ops, gynae. So this is one way to classify. Many students keep on asking about if they should go for a systemic study. So systemic study is nothing but if you combine physiology, pathology and medicine, this is what we have typically as a systemic study. Also, you can combine anatomy, ortho and surgery together. However, I will just recommend that physiology, pathology and medicine can be combined together because all the books have similar chapters in all the three subjects. Anatomy, ortho and surgery, it's not very convenient to combine them. So the second way to classify subjects would be these: anatomy, biochemistry, pharma, micro. These are the relatively preclinical or paraclinical. So this will be the big subjects, in which systemic can be physio, path, medicine, and these are the small subjects. So however, I'll still say that you should not go for systemic study for Indian PG exams because most of the books which are available are based on subject wise. They are not based on systemic wise. So, but however, if you want to follow, you can follow even this classification. Moving forward, there are three principles which I have used to guide you in terms of how should you cover your subjects. The first principle is complete as many subjects in minimum time as possible. Now, once we start, many people generally would take two approaches. Either they will start with first year subjects, anatomy, physiology, biochemistry first, or they may start with a subject which they typically find it very tough, or maybe a subject which has maximum number of questions. This is not a very convenient approach. I'll show you further. Second is, since you are targeting to complete maximum subject in minimum possible time, the second thing you have to do is keep revising whatever is completed right from day one. And third thing is, there are certain subjects which you find tough. For those subjects, you should always start solving questions from the day one. Let's move forward and see. So the first step you have to do, and this is the most important step, this is will take you around 30 seconds. You have to classify subjects as per your learning into easy, indifferent and difficult. So this is my classification. You have to do the same exercise for yourself. For example, I find surgery, peds, radiology, pharmacology, anatomy very tough, but I find biochemistry, microbiology, forensic, PSM, ENT, psychiatry, gynec, history, skin, all these very easy. These subjects are indifferent. I mean, I don't find them tough, I don't find them easy also. So you have to classify the subjects as per your level, your interest in various subjects. So easy, which you find it really easy, exciting to do; difficult, which you don't want to do these subjects; indifferent is okay, if I'll have time, I can do it, I don't find them difficult. The second step is rearranging the subject within the group. Like, say, in the easy group, ENT, then skin, psychiatry, forensic, I have just rearranged with biochemistry at the bottom because ENT is the most easiest one. Similarly, for the indifferent one and difficult one also, anatomy, surgery is at the bottom. In fact, I barely passed my first prof in anatomy. Surgery also I didn't do very well. So this is my list of subjects. Once I do it, I know that first I'll cover all my easy subjects in this order, then my indifferent subjects, and then finally, if I have time, I'll go for my difficult subjects. Now, obviously, the question would be, these difficult subjects are also sometimes subjects which will have maximum marks. So how to go about it? So let me come to it. First is rearranging the subject, and then you have easy and indifferent. For all the easy subjects and indifferent subjects, you have to choose one review book, complete it, and start revision from day one. So for these subjects, you will be, because you find it easy or indifferent, you don't find it tough, you will be on an aggressive mode. You will take one review book and you will complete it and keep revising it multiple times. For the subject which you find it tough, you will not be able to complete it from a complete book. Then what I advise is a retrograde study. Retrograde study is you have to keep solving MCQs from day one, especially the 5 past year papers of important examination. Make selective notes and do a topic wise preparation. So for difficult, like say I find anatomy difficult, and I know I'll just solve, like say, AIIMS 2017 paper, AIIMS 2016 paper, or NEET 2016 paper, whatever it is, and I'll see what are the questions asked. I will learn. There's a small pad, script prescription pad which the MRs will typically give you, or you can make your own notes pad, like by tearing a page into 4 parts, A4 page into 4 parts, so each will have a small and you can keep making just the notes of important points which have been asked. What it does, it reduces the amount of work for the difficult subject. You keep learning a lot of information about your difficult subjects, and over a period of time you will feel more comfortable with your difficult subjects. Also, since suppose a question is on radial nerve asked in 2017 AIIMS, you go back and read just the radial nerve, so it will reduce the content which you have to learn, and slowly and steadily you will become more comfortable with your difficult subjects. And the chances are, because you have covered all the important topics of past 5 years, you could be able to solve almost 60 to 70% of the questions even from your difficult subjects by just giving an hour of solving questions and making selective notes. So this is how I would suggest. This is a small exercise for you and you should do it. And if you like this video, don't forget to write and feedback to me. You can write your feedback to abhishek@medicoapps.org. Thank you.